gentlemen, welcome. For the medically minded in the audience, to healthcare investment, to digital health, to health equity, and of course manufacturing with a focus on vaccines. And it's in this spirit that you are welcomed to this summit. It's in this spirit that all the protocols and all of our dignitaries, deeply respected and welcomed, are indeed welcomed. So with that, over the next 2 days, look out for integrity, look out for benevolence, and look out for capabilities, because if you find them, trust will emerge, and if trust emerges, we can transform the healthcare system. So thank you so much for joining us today. My name is Dominic Wilhelm. I'm the Executive Director of the Global Trust Project, and I would like very much to welcome on stage now the President of Informa Markets, based out of Dubai, and overseeing the Middle East, Africa, India, Turkey, and beyond. So with that, Peter Hall, would you please join us on stage?
Thank you, Dominic. Good morning, ministers. Good morning, excellencies, distinguished guests, ladies and gentlemen. Welcome to Rwanda, welcome to beautiful Rwanda, and welcome to this vital International Health Ministerial Summit, focusing on strengthening health systems. Thank you to Dr. Sabin, Minister of Health for Rwanda, and all at the Ministry of Health in Rwanda, and also thank you to the Bureau for their unwavering support and for hosting this inaugural event, the first event. Also, thank you to our esteemed lineup of expert speakers, our industry sponsors, and our impact partners. Without their support, this first-of-a-kind event just would not be possible. This summit brings together leaders from across nations to share strategies, innovations, and actionable commitments. Our discussions will focus on universal health coverage, financing mechanisms, digital health innovation, vaccines and manufacturing, and partnerships to ensure equitable access to quality healthcare. Rwanda's own journey in healthcare transformation, marked by improvements in access, quality, and equity, exemplify the power of strategic investment and collaboration. We aim for this summit to inspire practical pathways for fortifying health systems, learning from each other, and building momentum towards healthier and more resilient societies. Thank you all for being part of this global effort. Thank you all for traveling, some of you from far and wide, to be here. Together, let us move forward with determination to create stronger, more inclusive health systems for all. And we look forward to this becoming an annual event for the continent. Thank you so much. Enjoy the event.
There's a lot that's going to be going on over the next few days, as we all know. If we can find, as I just said, benevolence, capabilities, and integrity in each other, we can do extraordinary things. There is one person who should be with us today, but can't be with us. And it's their memory that we're going to take with us into the next 2 days. I'd like to take a moment, please, to honor, known to many of you in the room, to honor Dr. Faustine Undogalila, the African elect director of the World Health Organization. And as we move into a moment of silence, let's just reflect briefly on how this extraordinary person exhibited those three qualities of trustworthiness that bind systems together, that help systems to thrive and to overcome and to transform. Dr. Ngolele demonstrated unwavering integrity, advocating for evidence-based solutions even when it required courage to stand against the highest authorities in the land. He embodied benevolence, dedicating his life to improving health equity and championing undeserved communities. And he showed unmatched capabilities, earning him the elect title of African Regional Director to the World Health Organization. So, ladies and gentlemen, would you please join me and stand for a moment of silence as we honor Dr. Indugalile's memory. Ladies and gentlemen, thank you. From what I know of Dr. Indugalile, he would want us to give this horns, so to speak. So let's take that spirit into our first keynote, and as we tackle the next 2 days to strengthen healthcare systems. I would like to welcome now on stage Dr. Mazganga Lucy Mazaba, the Regional Director of the Center for Disease Control here in Africa, based in Kenya, more specifically Nairobi. Ma'am, welcome to stage.
Allow me to recognize Your Excellencies, honorable ministers, distinguished guests, and all protocol observed. Indeed, it is an honor and a pleasure to be with you at this important International Health Ministerial Summit being hosted by the Republic of Rwanda, fondly referred to as the land of 1,000 hills. And I hope you all have an opportunity to see those 1,000 hills. I bring you greetings from our Director General, His Excellency, Dr. Jean Kaseya, and indeed from the staff of the Africa CDC Eastern Africa Regional Coordinating Center. Colin said it all in the few words during the opening, but allow me to just, highlight the importance of this meeting and why we're here. Seeing there's so many ministers of health here and excellencies really emphasizes the shared commitment in strengthening health systems globally and more so within our continent, Africa, ensuring that they are resilient, equitable, and capable issues meeting both current and, of course, future health challenges. The theme of this conference, Strengthening Health Systems for a Better Tomorrow, indeed comes timely as we continue to experience various emerging and re-emerging health crises globally. Allow me, ladies and gentlemen, to commend the various delegates, including the high-level state and non-state actors, the researchers, the pharma industry, and the various business entities that are participating in this summit. I believe that out of the summit will be great conversations that will reduce that gap that has been spoken about earlier, ensuring equity and access to good health care across the member states within the continent. When you reflect on Africa's journey, we continue to face many health challenges, but what is exciting is that we are rising above the occasion to address these challenges. We're pushing the agenda on access to medicines and diagnostics, research and innovation, financing opportunities, and so on and so forth, all towards a better tomorrow. Over the past decades, Africa has made commendable strides in health outcomes. I'd like to highlight the focus of our host country, Rwanda, Honorable Minister, on the community-driven universal healthcare models that have not only boosted immunization rates, but also enhanced the overall health of our communities in the country. The defined framework for future healthcare improvements is something we can all draw lessons from, and I'm pleased that Rwanda, Honorable Minister, you are playing host to this critical summit. As a global community, we have various experiences to draw lessons from. The COVID-19 something we're still getting out of, but in the conversation I had with Professor Luo today, she was talking about, yes, we don't have a lot of new infections on COVID, but what about the post-COVID long syndromes? That's another area that we need to focus on. We've also recognized the issues of climate change significantly impacting on our health security. And although the continent contributes to the least in terms of the causes of this crisis, it bears the greatest burden of suffering with significant health impacts due to extreme weather events and natural disasters. Addressing the drivers of climate change, therefore, can help us improve our health outcomes. We also see an increase in the number of zoonotic health challenges posing an important concern that needs to be addressed. And I hope that this occasion will allow us to discuss and delve into solutions around the issues of zoonotic infections. Ladies and gentlemen, Your Excellencies, the Africa CDC, mandated by the heads of states and government, is focused on pushing the agenda for a better and healthier Africa. The Africa CDC's vision for a safer and healthier Africa is well articulated in the new public health order that emphasizes the urgent need for a fundamental paradigm shift towards the equitable and just public health landscape. My good friend Amit wants us to refer to the new public health order as the SDGs for the African continent, and I can't agree with him more. Honorable Ministers, Your Excellency, distinguished guests, we need to refocus and move the agenda in advancing strategies and indeed policies that will assure a better tomorrow for our people. Allow me to share with you all Africa CDC's new public health order, which serves as a guiding framework to transforming Africa's health systems. It's built upon 5 pillars, and allow me to go through them. The first pillar being strengthened public health institutions. I think we all agree by now that national public health institutes are the vehicles for national health security, and I know that different countries are at different stages, but I think the idea is generally welcomed. We need this specialized entity that will undertake public health surveillance and disease intelligence that will enable timely detection and reporting of health threats. And therefore, we must equip these institutions or their equivalents, depending on the country, with the tools and resources for innovative coordination of surveillance and response to public health threats. At Africa CDC, we support member states in strengthening NPHIs that are already established or in establishing them thereafter. And currently on the continent, 23 member states have established national public health institutes. However, not all of these are fully operationalized and functioning, but there is room for progress. We have launched a strategic framework to strengthen cross-border surveillance and information sharing among member states to address the increasing cross-border public health threats driven by the factors such as conflict. As we support this, we are also supporting the Public Health Emergency Operations Centers as indicated in the Lusaka Declaration. Digital health remains an important aspect, and we are, in collaboration with the Digital Impact Alliance, pushing an agenda to improve digitalization on the continent. Our second pillar is public health workforce, and I think you can agree with me that we need a specialized workforce, people who are trained and capable to respond to the public health emergencies that continue to threaten the member states on our continent. To enhance the leadership capabilities of health ministers, the Africa CDC launched the Ministerial Executive Leadership Program in 2023, which aims to catalyze transformation in the public landscape of African member states and continue realizing the Agenda 2063, the Africa we want. So when you talk about health workforce, it's not just a technical aspect, but also the strategic aspect that we need to emphasize on. We continue to expand workforce development to address critical gaps in the member states, and some of them are through initiatives such as the Kofi Annan Global Health Leadership Program, the African Epidemic Intelligence Service, and the AVOC Search Program. The third pillar is expanded manufacturing of vaccines, diagnostics, and therapeutics. We know that the continent imports up to 70% of the annual demand of pharmaceuticals, with 30% locally produced and not traded. Heavily relying, of course, on imports can hamper our ability to effectively respond to outbreaks. I think we've learned a lot of lessons through the COVID-19 pandemic, the Marburg situation, and the Mpox. And so we can't emphasize the need for improved local manufacturing and trade. We need to help reverse the over-reliance on imports from other continents. And to do this, the African Union of Heads of States put in place the partnerships of African vaccine manufacturing under the African CDC, with an ambition of developing an industry that will produce at least 60% of our vaccines by 2040. Currently, we have 25 vaccine manufacturing companies on the continent at different stages. 10 of these have actually installed capacities. The 3 manufacturers are set to manufacture up to 8 vaccines for the continental market in the coming 3 to 5 years. I think we should give ourselves a clap for that. Honorable ministers and distinguished guests, Africa CDC remains committed to fulfilling the African Union's mandate to advance and make local manufacturing of all health products a reality. To achieve this, Africa CDC is proudly partnering with our sister organs, the AFC, FTA, Secretariat, and the AUDA, NEPAD, and looks forward to full operationalization of the African Medicines Agency based here in Rwanda to calibrate critical interventions to support manufacturers to deliver quality, safe, and indeed effective medical products across the continent. Our fourth pillar is around increased domestic resource for health security. Indeed, for us to have resilient health systems, it's important that we begin to invest domestically, finances, local resources, fostering strategic public-private partnerships so that we fund essential health services, ensure equitable access to innovations, and indeed accelerate progress towards universal health coverage. We must prioritize domestic financing. This is, there is no need to even deliberate over this. It is quite obvious. Member states should adhere to the Abuja Declaration, where at least 15% of the budget allocation goes to health, and the African Leadership Meeting Declaration increasing domestic investment in health. Our fifth pillar looks at respectful and action-oriented partnership, and I can see Amit smiling. This is always our point of discussion, because this pillar is important and it emphasizes the importance of collaborative efforts in addressing public health challenges. A recent example to this is our response to the Mpox outbreak in August 2024. The Africa CDC declared this outbreak a public health emergency of continental security, a historic first, and subsequently launched a joint continental response plan with the World Health Organization and many other partners. For the first time, we're able to establish a single unified approach with one plan, one team, one budget, and one M&E framework. I think that is really important. We have so many silos, so many organizations putting a lot of pressure on the governments. And so if we work together and use one system, it will definitely help us achieve better. As I go towards the end of my remarks, allow me to shift a little bit of focus to another critical area of public health, which is women's health. Maternal health remains critical on the continent, accounting for 2/3 of the global maternal deaths. That is really serious and detrimental. Many of which are, and yet many of these are actually preventable. improving access to quality obstetric care, comprehensive reproductive health education, and better health literacy, healthcare infrastructure, and community-based interventions are essential for safe pregnancies and childbirth. We need to empower our women with education and economic opportunities and tackling gender discrimination in healthcare access. We need to lead to better health outcomes for women, their families, and indeed their communities. And this can be done by focusing on the different areas that will significantly improve the health of women across the continent. Honorable Ministers, Excellencies, distinguished guests, as I conclude, it is clear that achieving our health goals requires collaboration across countries, across sectors, with local and global partners. We indeed need to forge these strong partnerships, share knowledge and information, and support each other in building resilient health systems. Our renewed commitment should focus on domestic resource mobilization, investing in innovative surveillance and response systems, empowering our healthcare and community healthcare workforce, accelerating local manufacturing of vaccines, medicines, and health supplies, fostering health science research and development, and strengthening cross-border collaborations. Indeed, we must focus on promotion and prevention of disease, making health the responsibility not just of the Ministry of Health or the ministries responsible for health, but the whole government and whole society approach. Ladies and gentlemen, together, let us build resilient health systems for a healthier, more secure future for all African people. Thank you so much.
So we have some extraordinary guests today, but here's the thing, as you probably know, they're all involved with the healthcare sector, right? As such, the esteemed guests and speakers we have today are action-oriented. So we've made a decision, and that is to leave the depth of their CVs, their experience, their background, what they do with their everydays to the program. Because we appreciate that when they're here and there is bandwidth and there are eyes and ears on them, they're not here to talk about themselves. They're here to talk about the issue, which is a strengthening healthcare system. So for all of our panelists, moderators and speakers and contributors, all of their information is on the program. Okay. Now, from strengthening healthcare systems, thank you so much for the opening address, ma'am. We think, of course, of universal healthcare. SDG 3, a pipe dream without primary healthcare. The wonderful thing about primary healthcare, yes, a great challenge, but an extraordinary opportunity. Done correctly, it can be an incredibly cost-effective way to address current and downstream realities. The vast majority of those realities can be addressed with primary healthcare. And thinking of that, we think, of course, to Astana. Just a few years ago, 2018 in Kazakhstan, that declaration focused on bringing about primary healthcare. So our next keynote will address just this, moving from a declaration to action. With that in mind, I'm delighted to welcome now on stage to speak about shifting the primary healthcare gear by action. Please welcome Dr. Barasa, the Health Cabinet Secretary within the Ministry of Health in Kenya. Doctor, welcome. Welcome.
5 years ago in Astana, we made a collective promise to transform primary healthcare. Today, I stand before you to share how Kenya has turned that promise from a declaration into a tangible, life-changing reality. Our journey has been one of moving from commitment to comprehensive action, backed by the fact that when we signed the Astana Declaration in 2018, we committed to more than just words. We committed to a fundamental transformation of our healthcare system, centered on the belief that quality healthcare is not a privilege, but a fundamental human right. On 19th October 2023, the President of the Republic of Kenya enacted into law 4 bills to accelerate universal health coverage achievement. These laws are the Primary Health Care Act, the Digital Health Act, the Social Health Insurance Act, and the Facility Improvement Financing Act. Through these laws, we have had an intensified shift from curative to preventive and promotive health in line with the Astana Declaration. We have empowered and revolutionized community health by recruiting 107,831 community health promoters whom we trained on basic and technical modules, equipped them with essential health kits and smartphones with an online reporting app, which is called the ICHIS, that's Electronic Community Health-Based Health Information System, and they get a monthly stipend of $50. These are our first line of defense in our healthcare system, since they visit households and upload health data in their smartphones and refer clients appropriately. The data entered by these foot soldiers into the smartphones is accessible at all levels in a dashboard. Currently, we are using them to accelerate uptake of our social health insurance, and so far, within 2 months, we have been able to register 16 million Kenyans into the social insurance. Ladies and gentlemen, another transformative strategy that Kenya has embraced is systemic redesigning of our infrastructure by mapping the country into 315 primary healthcare networks or strata. So far in 1 year, we have established and operationalized 206 primary care networks in the 47 counties, with active multidisciplinary teams meeting every month and quarterly to review their health data and establish community and network-owned solutions for sustainability purposes. These networks are hubs and spokes at the lower level where community units are linked to a primary healthcare facility, and these are linked to a primary referral hospital. These facilities are either government or private or faith-based. This is aimed to address access and strengthen referral system, including reverse referral and case management, where we have family physicians and specialists visiting lower-level primary healthcare facilities and community on scheduled dates. The primary referral hospital is the hub, and the primary healthcare facility, that is the health center and dispensaries, are the spokes, with community units as sub-spokes. Ladies and gentlemen, Kenya has embraced strategic financing investment towards achieving 9-to-1 return on investment in community health. For instance, we have allocated resources for training 2,400 community health officers or assistants. 43 counties out of 47 have been matching our national $25 per community health promoter per month, and we are exploring more ways to make primary health care more sustainable by allocating more monies from the exchequer to supplement the donor funding for primary health care. Our community health helped us demonstrate resilience during the COVID-19 pandemic response by mobilizing people for vaccination, conducting extensive contact tracing, providing home-based care, and disseminating vital public health information to the community. This team has also been used in recent outbreaks of Mpox and cholera in Kenya, and have helped to contain these diseases from spreading and enhancing community prevention and health promotion measures. Ladies and gentlemen, our commitment as a country of shifting the primary healthcare gear to action has not gone unnoticed. Kenya has gotten global recognitions. We were awarded a certificate of recognition at the 3rd International Community Health Workers Symposium in Monrovia, Liberia in March 2023. In addition, Kenya was recognized by the World Health Organization for innovative community health strategies in 2024, and we have hosted learning exchanges on primary health care with Ethiopia, Malawi, Zambia, and the UK. Our journey continues with ongoing efforts to refine primary healthcare networks, enhance community engagement, improve data utilization, and strengthen health system resilience. Kenya's primary healthcare transformation is a blueprint of what's possible when political will community participation, and strategic planning converge. By embracing primary healthcare as the pillar of universal health coverage, we are not merely providing healthcare. We are building healthier, more resilient communities. We are proving that universal health coverage is not just an aspiration, but an achievable reality. Thank you very much.
It's a real pleasure to see the ministers here, members of the private sector, health leaders, and all the dignitaries who are involved in the African healthcare space. So, well done, Minister Sabah Sanzimana, to be hosting us as the host minister. I'm really happy. You've got North Africa here, you've got Southern Africa, you've got East Africa, Central. So I think we're really a continent represented. It's a delight that many people have traveled from far and wide. So many other firms and organizations and champions have come for this dialogue. Truly, I must thank Informa team. Peter, what you talked about earlier today, you, Sally, Tom, and your entire team. I met Cynthia as well. This is your first of a kind from all your products. And you've already announced that it's going to be an annual event. So you're going to create a stage on bringing us together to build trust and to build this partnership. So I think we should give you a big round of applause for taking that. And take the message to your team that we in Africa truly appreciate any kind of platform that brings us together to bring real good smiles and better health to the people of Africa. Do I have the next slide? No, first slide. She's the reason we are here. And collaboration is the new innovation. This is the smile that we all want to see on her, on him, on the kids, on the families. And if we're going to go away in these 2 days, and we continue to do what we want to do, and we see these kind of smiles through a stronger health system, then each one of you have done your job. And it's only going to be done through the collaborative engagement. There are two words here that I really want to speak about: collaboration and innovation. Innovation is something you discuss in your organizations, in countries, in companies. And it's about doing things in a new way. It's about doing things in a better way. It's about doing things which are more appropriate, and it is ideas that brew when you bring in leaders that share knowledge and bring in ideas. But those ideas are nothing if they're not implemented. Those ideas remain documents. Those ideas remain policies. Those ideas remain business plans, and they remain a wish list, and they gather dust. The only thing that makes an innovation make a difference to the people in health are the individuals that you bring on the table. People matter. People matter in countries. People matter in companies. Without people and the right kind of people around, none of your innovation is going to lead to results. And that is the spirit of collaboration. Collaboration does not require ranks. Collaboration does not require hierarchy. Collaboration requires diversity. You bring people around you who have different ideas. Bring people around you who are of different ages and different thoughts. That's when you can say collaboration is the new innovation. 32, 35 years in my practice in Africa, largely in Kenya, but also extending in other parts of Africa, I have seen that we've tried to strengthen health systems through many directions and through many programs and policies. But there's one wake-up call for Africa that has been really startling. And this shook the entire country. This was COVID-19. COVID-19 laid bare what we have been not doing. To be honest, we were really, really slipping. It showed us our weaknesses. It showed us it was about time for us to wake up and think about health equity in a complete different way. We need to rely in Africa, by Africa, for Africa. We need to build systems that will rely and build on the strengths that we have. Partnerships matter. Global partnerships matter. Engagements with the multinationals and development partners matter. But the structure and the foundation should be truly African. COVID-19 also taught us that if we want to succeed in health systems, it cannot be done alone. Every country in Africa that worked through a partnership model, and many of you were champions here. I know Dr. Gwelo was one of the champions at Africa CDCs. Saban was there, the ministers who are here. Every country that cooperated with the stakeholders within the country had their case fatality rate go down. The number of deaths in those countries came down. It was then we all did realize that indeed collaboration is the new innovation. Just like music. We all know to make music, we must play together. And when we play together, like this orchestra, the health system becomes stronger. By the way, many of the people here believe in competition. And competition is great. I'm a firm believer of competition. Competition will improve quality. But collaboration will improve health systems. There is the big difference. Whether you're multinational, whether you are an SME, whether you're focusing on community care, or whether you're focusing on global health. If you look carefully at all the players within this orchestra, they all must play at the same time. And this is exactly what Dominic spoke about earlier, trust. And to build trust, it must start with an open dialogue. Through the dialogue system, you build trust, because in the end, we are here for her. We are here for the patient. Whether you are a public sector or a private sector, whether you are a multinational or development partner, whether you are an FBO or a CSO, whether you are a philanthropist or you're an investment banker, in the end, you want the health system to improve through collaboration. Multiple partners in this space continue to talk to each other. This is one great platform that I can see. There may be some people not here, there may be some actors not here, but as we go along, Peter, we try and bring the whole orchestra to play the same note, so that when we go back to our countries and our regions, we produce the health system for tomorrow, which will be stronger than what it is today. Because eventually, we want to make sure that no one is left behind. Thank you so much.
So thank you, Doctor. Next up, we're going to move to the official address of the morning. And this honorable guest knows all about trustworthiness. They know what it means when hundreds of millions, tens of millions of people look to them and to their ministry for healthcare. They're looking for trustworthiness as it's exhibited through integrity, benevolence, and capabilities. So perhaps one of the most qualified people in the room to be trustworthy is the Honorable Minister, Dr. Sabin Nsanzimana, Minister of Health, here in Rwanda. Honorable Minister, please join us. Welcome, sir.
Good morning. Bonjour. So welcome to Rwanda. Honorable ministers, distinguished guests, it's a pleasure to join you today because the topic is very dear to all our hearts, especially the people working in the health sector. And there's nothing more important than the lives of people, the health of people. And when you talk about strengthening health systems, you're talking about everything. When people are healthy, they're happy, they're productive, they raise their families, we're all happy. There's a common saying here in Rwanda that there's no better investment than investing in our own health. So health is not a negotiable investment, it's actually human right. You all know that. And this starts with us, then to everyone within our institutions and countries. So as a host country for this first International Ministerial Summit, I'm very pleased to have you all in Kigali, in Rwanda. And I believe that this is going to be an important contribution to what we've been doing already in other fields, in other meetings and conferences, but beyond just meeting into action. And I like what the moderator mentioned from the beginning, not just discussing, but also is implementing small steps, why not big steps? And thank you all, my colleagues, ministers who traveled. December is not an easy month, but we made it. You came here, and to our co-organizers, the co-host, thank you, Peter, and your team. And thank you also to all the tech, pharma, business people, civil society, government, non-government institutions represented here. Really appreciate your contribution. It's not someone's business, it's our business that we improve what we do. So I was reflecting on what I would say, and the Minister of Health of Kenya, my sister, Sansana, she mentioned almost what I have to tackle, and we appreciate what Kenya is doing in community health, especially community health workers. We've been learning a lot from your work, and we continue. So for every Minister of Health who is appointed, you think about probably 4 or 5 things, what I would call the 4S or 5S. Let me use 4S. Number 1 is staff, the people, because everything we do is about people. It's about the doctors, the nurses, community health workers, engineers, pharmacists, everyone. The human resource managers, it's people. And in health, people, actually there are people who are going to save lives within minutes, within hours. And across the continent, at least to the data we have shortage of people, staff, that are needed to take care of the lives of our citizens in our respective countries. If you look at the ratio, we are to 1 overall, 1 provider for 1,000 people. Talk about doctors, nurses, and midwives as an example. And the World Health Organization has come up with the minimum ratio. If you are below, your healthcare system is going to have difficulties and even to collapse if you have an additional pressure like an outbreak or pandemic. And that is 4 providers for 1,000 people. And across the continent, we are at 1 or less. This is a high risk, a very high risk. And that's why as a country, as Rwanda, we made it our first priority is to increase the number of healthcare workers, at least to reach the minimum acceptable level. And this has to happen very quickly. So we set a target to achieve it within a period of 4 years. And that is from 1 to 4. It's 4 times, 4 years. It became our slogan now. It's a flagship priority called 4x4. So quadrupling the healthcare workers within 4 years' time. We are implementing already in the first year. And we see that is actually going to happen because the first year enrollment into medicine, into pharmacy, into sciences, we managed to achieve 3.6 times enrollment in the first year of implementation of this strategy. And the cost we are putting in is an effort of many, many people. If we have to wait doing nothing, to take us 185 years. And that's the same situation for the whole continent. This is about people. The second S is space. We're talking about infrastructure. We're talking about where these staff, these people are going to be doing their work, treating people. We're talking about theater rooms. We're talking about ICU, emergency. We're talking about health centers. We need infrastructure. We need to build our health systems by having physical space where people can come and receive care. But these are the things you can do in a matter of months and probably even faster with the technology of construction. If you have money, you can do it very quickly. But the first S is something you have to prepare, invest, actually 10 years, even 20 years before. Any month you lose by not investing in training someone, it's a lost opportunity for future generations. The first one remains the most important priority for health systems. The space is important as well. You limit infections, you have better way of doing things per standards, the quality you mentioned, and we need it available, accessible, centralized up to where people are, not people coming to capital cities to seek care. That is the space. And number 3, the third S is supplies. The healthcare systems needs to be supplied 24/7 uninterrupted. You need medicine, you need medical equipment, you need devices, you need oxygen, you need papers, you need tissues. This supply chain system that has to happen all the time. And this is linked from manufacturing, transport, quantifications, procurement, and you need to make sure that doctor who is in the theater rooms doesn't struggle to find a needle to finish the surgery because the supply system has been interrupted, because you can't manufacture the needle on the continent or in the country. It has to come from somewhere, and there's a war, and then the ships are not moving, the flights are stopped because there's an outbreak. So these are very important. Supply is probably most important. We've seen it in the COVID-19 when we are all grounded, and even for the simple thing as a mask to cover ourselves was not available here. And as we speak, today we must make sure that these supplies are produced here on the continent. They are produced at the lowest affordable and available cost and mechanisms. That is how we can build really strong systems. It's not about heavy procurement that are not certain. So we need to come together as one team, living in different places of the world, but addressing the health issues in a collaborative way. And the fourth S is actually the systems, the governance, the structure that we as leaders in different fields, we need to ensure that we have proper guidelines, we have proper coordination, we have things that help people to access care at the lowest cost, and you break the barrier of financial accessibility through insurance coverage and so on. These are the things that seems quite easy to do because of papers and coordination, but sometimes when they lack, everything else is not there. It doesn't happen. So those are the four things as ministers, as leaders, we think about every day. But now the next step is how do we make this into practice, into action? You need to have teams. You need to have people who understand, who follow the science, who knows exactly what is next, not sticking to the routine of the past. We need to embrace technology, because if I can't train all the radiologists I need for my country now, I have only 15 in the whole country, and the needs, I need 10 times, 100 times that number. What do I do until the next radiologist graduate? Do I stop treating, or do I? So I need to see how technology can help me to catch up. That's the role of AI, for example. AI should be helping us to catch up with these gaps we've accumulated over time because of legacy of different issues in our countries. And this can be cross-cutting. It's a helping tool. It's not going to replace people. We always need to train people, but these other tools will make people work better, faster, and more efficient, especially in our context where we have a lot of things to do, and yet those people to do it and the systems to do that are limited. So embracing technology, embracing partnerships and innovations is going to be the key factors for us, especially in low, middle-income countries, to catch up. If you're open enough and ready to collaborate with those innovators. And here in this room, I believe we have solutions for everything. We have solutions. We have problems we are exposing. We have people who are thinking about it. We have innovators, pharma, tech, everyone in this room. By the end of the day, if we all put our contributions, our knowledge, and our skills together, I'm sure we can change something. So this forum, to me, is important. We don't often have such kind of gatherings where we address the same issue from different backgrounds. You'll see ministers meeting somewhere, then discuss about their issues, then tech in another room, then academic, then pharma, then at the end, there's no one bringing things together, yet we work for the same people. Actually, we work for ourselves. We work for the people we left in our respective countries. So I wanted just to bring these reflections that if we go into actions, even with small things, with $1, we can make a bigger impact. But staying backwards, reflecting, discussing again and again, we're not going to make progress. And one quote I read this week, probably most interesting to me, was, if you want to not make a decision, ask everyone. If you don't want to make a decision, ask everyone. Because consultation will never end. But move into action, adapt, and then even those who are willing to help will come with you. Sometimes you move into uncertainty, then you have people coming to laugh at you, say, this is too ambitious, this is crazy. But if you look in the history of the world, those crazy ideas have changed. And then now, so you see, he started a crazy idea now to become a new standard. So let's all think in that way, that support those innovators, support those policies and actions that seem to be crazy and impossible. But yet, if we support it, it can be a new standard of catching up, of changing the world in health. And there's no better way to do it than now. With digital technology, with our young people, the ambition, and I can see it in the room. They can't wait to create new partnerships and projects with you all in Kigali and following this meeting. Thank you so much for everyone who made this happen, this event. Appreciate and enjoy Kigali. Thank you.
Thank you so much, Honourable Minister. I would like now to please invite our honourable speakers that delivered our opening session. Would you please come to the stage for a photo opportunity?